My name is Jackie, and this is my story with Galleri. I live in Arkansas. I'm a professor of education. I've been teaching 45 years now. I started off as a special education teacher working with kids with a variety of disabilities and behavior disorders and kids who are autistic. In my spare time, I like to write Western novels, and I also raise miniature donkeys. On my mother's side of the family, there's a very strong history of cancer. That's one of the things that I always discuss with my family doctor. I was watching the local TV station, and one of their news reports was that the Mercy system here in Fort Smith was starting to offer the Galleri test, and it was to screen for a wide variety of cancers. I thought that, well, that sounds pretty promising. Next day when I saw my family doctor, I asked her about it, and she said she would recommend it because she thought that was kind of the way of the future. The Galleri test is a simple blood test that screens for many different kinds of cancer before symptoms appear. When I received the initial report back from the Galleri test, it showed that there was a cancer signal detected with a predicted origin of soft tissue and bone cancer.
I'm Dr. Daniel Mackey. I'm a medical oncologist. I've been with Mercy for 7 years. I got the call about how we had a patient who had a positive signal with the Galleri test, and the patient was going to be seeing me in the office. And I remember that day reviewing the patient's chart just before going into the patient's room, and I'm thinking, here I am, I'm about to see the first patient across the entire ministry who tested positive, having no symptoms whatsoever. And so it was humbling. And I remember thinking that very day, that history is changing. And I was just stunned to be a part of it.
At that point, they were able to schedule me for a CT scan, and the CT scan did confirm that there was a mass.
Jackie's tumor, typically it is not found until at least twice the size that it was when it would be causing problems. Because where it was located, he wasn't having any problems at all yet.
I just had my yearly physical, and all the test results were perfect. I had no pain, I had no symptoms at all. And so the Galleri test was able to show this signal that I may potentially have cancer much sooner. It was real critical, I think, for me that this was detected so early.
He did go for surgical resection here just a few months ago with negative margins. He's recovering. He's in Florida now with his grandkids at Disney World.
I had no symptoms, no indication at all that I had cancer. This particular test was able to detect this, and that allowed me to get an early start on treatment, which I think is really critical in dealing with cancer. It's really hard to say how much this test has meant to me personally. This particular test is the way of the future. I think it's going to make a lot of people's lives a lot better.
Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origins. After diagnostic evaluation, around 40% of people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Galleri should be used in addition to routine cancer screening. Galleri does not detect a signal for all cancers. False positive and false negative results do occur.